Hello, Dr. Schuman. This is Kerry Duke. How are you today?
I'm doing great, Kerry. How are you this morning?
Well, doing very well. We've had a nice rainy weekend in Atlanta, but it's cool.
Yes. As we have here in St. Louis.
Okay, so we have a great topic to talk about today. First off, you're Dr. Schuman. You're with the Schuman Center Dental Aesthetics,
Correct.
and you're in what city?
St. Louis, Missouri.
St. Louis, Missouri. Okay, so let's talk about braces. Let's talk about braces, orthodontia, and Invisalign. And what we want to talk about today are the most common questions, the frequently asked questions, and maybe the questions that people should be asking, but they don't. Sound good?
Sounds perfect. I can handle it.
I bet you can. All right, so here we go. The first question we want to ask about are what are braces and who should consider getting braces?
Well, very good. Braces, or orthodontics in general, is a mechanism whereby we can take teeth which are not straight and make them straight. That's important for a number of reasons. One, of course, is cosmetically, and that's probably people's most common reason for doing orthodontics. But also occlusion, the way the teeth mesh together. The upper and lower teeth have to mesh together like a set of gears, really. And if people are having what we call occlusal problems, the teeth don't mesh, it results in a number of problems. TMJ pain, the joint right here by the ear, pain there, and discomfort there, and that can be caused by that malocclusion as well. And orthodontics can correct that problem. Okay, gum problems. If teeth are kind of folded over each other, the gums don't like it. It's tough to clean. It provides a trap for plaque and bacteria, causing us gum problems. So, as I mentioned, there are three that I can think of. Cosmetic reasons to get orthodontics, malocclusion problems, the teeth don't mesh together properly, causing problems, and third are gum related, that we need to get those teeth lined up properly. Is that clear?
Very clear, very clear.
Good.
So, okay, so those are the three main reasons for people to, think about getting braces. Are there alternatives to braces?
Indeed, absolutely. And one of the first questions that I ask patients is, why are we doing this? And the answer is generally it's a cosmetic reason. Because if they're having pain somewhere, we hear about that. Or if they're having gum-related issues, we are able to detect it when they come in for their hygiene with the hygienist, their cleaning appointments. We're able to detect that as well. So it's generally a cosmetic problem, which seems to stimulate the discussion about braces of any type. And my question always is, what specifically is your complaint? And if it's just a matter of being crooked, we can help that. If it's discoloration or chipped teeth or something like that, more mechanical, that's a separate category. But I always tell patients that sometimes I get patients that come with crooked, ugly teeth, and they insist on getting braces, and we go ahead and do the braces, and now they're not happy because instead of having crooked, ugly teeth, now they've got straight, ugly teeth. So braces are not always the solution. Sometimes it's a more cosmetic procedure, which only takes 2 weeks, by the way, of veneers or crowns or something along that line.
Okay. What's the best age to consider getting braces? I hear lots of, discussion about, children and, 7, 8, 9, and then you have the adults that are thinking about getting braces. What would you consider the best age to get braces to be?
It's a wide range, anywhere from about 15 through the 70s.
That is
Honestly.
a wide range.
That is a wide range, yes, yes. Now, obviously, in the upper end of that range, at the top end, the senior end of that range, obviously people are doing this for gum-related, periodontal gum-related problems, that we need to get those teeth straight, that they've developed a gum problem. We want to correct that. And in the younger, it's because of either the TMJ concerns that I mentioned, pain up in the joint, and primarily, as I mentioned, cosmetic.
Well, I have a follow-up question because in preparing for our session today, I see lots of questions about, young kids being considered for braces, and I don't understand that concept. 7, 8, 9, 10-year-olds getting braces. I mean, what you mentioned the age 15. What is that? What is that? The magic about being, let's say, under 13 and getting braces? Why would a parent even consider that?
Sure. A lot of times as children and their teeth are developing, that they don't have enough room within the arch to accommodate all these teeth which are coming in. And in other words, you can have large teeth and a large arch in order to accommodate all those teeth, very much like a brick archway, a stone archway, that all those bricks have to align and take up a certain space. But if you have a small arch, you can't accommodate that. So very early on, we can anticipate that and put in an appliance which is an expansive. It expands the palate to increase the radius, increase the space for all those teeth or bricks or blocks to come and fit in. And that's why they do it early in the game.
That makes sense. Well, let's talk about the general question: how long is someone going to need to wear braces?
That's a great question. And just like the age of the patient, it's a very, very wide range. We just don't know exactly. Sometimes we have minor tooth movement. I'm not really happy that something is a little bit crooked. Can you straighten that tooth out? That's just a minor tooth movement, and that can take us just a number of weeks to get that accomplished. Other times we have real serious malocclusion problems, and it can take well over a year to do.
Okay.
But our average in this office, I would say, is probably about 6 to 9 months.
Oh, that's way less than I would have expected.
Yeah.
Back in the old days, it's generally 2 years.
Yeah. It goes pretty quickly. It goes pretty quickly generally, and it's a painless, easy procedure, and it's become very, very non-invasive. In fact, we are able to put on braces which you can't see, which is a real blessing.
We're going to cover that subject in just a minute.
Okay.
I want you to redefine a term for me, though.
Yes.
You're using a professional dental term, malocclusion.
Yes.
What, in layman's terms, what is that?
Okay. Well, imagine, I know everyone has seen, for example, clock gears, right? You know how they interdigitate, right? They mesh together. Mm-hmm. Well, if one tooth on there is too long, well, the machine is going to rattle, or something is going to break. Something has to give. And teeth are very, very much like that. The upper teeth, the lower teeth have to mesh. They have to mesh together in order to chew properly. And if they don't, well, patients experience pain, resulting in grinding and all types of other problems. So that's what malocclusion is, where the teeth are simply not aligned properly. And there are basically 2 ways for us to correct that, basically. One is through orthodontics, and the second, if it's not too bad, if it's minor, we're able to simply touch the teeth with a little bit of a diamond drill, our handpiece, touch that, mark the tooth, where is it hitting improperly, and just kind of tune it into place. And that's an amazing thing to do, that people that have been suffering from TMJ pain, the joint pain, and their face hurts in the morning because they're grinding all night, and we adjust the teeth, and they put their teeth together, and they say, oh my gosh, it feels so much better. And I ask them how to describe that. Can you put that into words? Describe that for me. And so many of them say, it feels like I could put my foot into a shoe and it fits, or my hand into a glove. It's just that they fit together much better than they did prior to doing that quick little procedure.
Okay.
It's a fine-tuning type of procedure.
Say that part one more time.
It's a fine-tuning type of procedure. People are able to chew. They're able to chew, but it's just not 1,000% comfortable. And once we make a slight adaptation to that, they're so much better, and they're able to perceive that difference immediately.
All right, here's the $60,000 question.
Yes.
If someone is already an adult, should they consider braces? I know you already mentioned that the age range goes out to 70, but but should they really consider braces?
Well, absolutely. Why would you not? And I will tell you from personal experience, let me tell you that my lead assistant, I had a little bit of a crooked tooth problem. It wasn't much of a problem to me because I've done okay with that. I've been fine with that. It didn't bother me at all. And I pushed her off for a long, long time. And then someone said to me, outside of the office, "You're in the business. Why don't you straighten that crooked tooth of yours?" And I was floored that somebody actually noticed that. So that was all that it took. And in fact, all this time while I've been speaking with you, I've been wearing my Invisalign. And it doesn't impede me in speaking in any way. And Carrie, you're not even aware that I'm wearing my Invisalign retainers.
No, I'm not aware of it, which is, it's funny you mentioned that, because the very next question I have for you is, what is Invisalign and who should consider this type of dental correction?
Very good. So I was ahead of you. Invisalign is a fabulous innovation in dentistry and in orthodontics specifically, that we're able to send this company, which has patents for this process, we send them impressions and photographs and x-rays, and their technicians and their doctors virtually align the teeth on their computers. Then they send us that rendition. And we call the patient in, we sit in front of the computer as you and I are, and we sit shoulder to shoulder and we look at their teeth on the computer. And we're able to manipulate that image, rotate it around, show before, show after, show every step along the way as the tooth goes from this crooked position slowly, slowly, slowly up into the perfect position. And it's really a wonderful modality. Once they are satisfied with that, and that I'm satisfied with that, we press a button on the computer. And about 2 weeks later, that company sends us all of these little trays. And in fact, I've got a couple of them right here. I'd like to show them to you, Carrie, if I could.
Please do.
I don't want to take mine out for you because that would not be very attractive. But this is what I'm wearing right now. It's a little clear tray. I'll bring it close to the camera so you can see it. Is that clear to you, Carrie?
It is. Can you turn it horizontally? Yeah, there you go. And speak so we can see you.
Yeah. And what this is, these are custom made for my teeth, and this is the first tray. Right now I'm wearing the second of a series. And in fact, when they arrive, they come like this. And I'll bring this very close to the camera so you can see this. It's got my name on it. And then do you see where it says U and L, upper and lower?
Yes.
Okay, so it gives I think this one is 2. Is that correct? Or is this 5?
5.
5. 5 of 9 and 5 of 10. And every 2 weeks I've got it marked on my calendar. Every 2 weeks I take out what I'm wearing, put them away, put them into the envelope they came in, take the new set, put them in, and wear them for 2 weeks. Now, of course, I take them out during the course of the day. I need to eat, so I take them out for eating, and I take them out for hygiene, for my brushing and flossing after each meal. And through that, I'm able to get the teeth to move slowly but progressively, and I can see the difference really from day one. Really, by the evening after I first started, I could see tooth movement.
Okay, stop right there.
Yes.
You're saying that whoever, an adult, a teenager, whoever can have Invisalign, and all they have to do is put that tray in their mouth, and they can do their normal daily activities, whatever they need to do, without having rubber bands or sharp things poking through their lips or any of that nonsense?
That's exactly what I'm saying. Not only am I saying that, but usually we don't have to have the patient back until the end of treatment. We do have them back just because I would like to monitor what's going on here. How is their hygiene? Are they keeping up to date with the trays? So I like to monitor things as they're progressing, so I like to see the patients back. But technically, I usually don't have to see them until it's all over.
Okay, you can hear the incredulity in my voice because I grew up in the era of medieval torture. You know? the little silver things that went around the teeth,
Yeah.
and the post, and the rubber bands, and it's really torture for 2 years.
Well,
And
I got to
so,
tell you, I will tell you. You remember the comedian George Carlin?
yes.
He said when people wax nostalgic about the good old days, just say one word to correct them. That word is dentistry. We have come light years in the past couple of decades in dentistry with the procedures that we can do, that it's comfortable, beautiful aesthetics. We can restore people's mouths, implant dentistry, a whole host of technologies, and Invisalign is just one of those.
I think that's a really important point to make, because even though folks want to have a better smile, a more comfortable smile, better ability to chew, all of those different things, they still have this big fear, and that is, going to the dentist, and the pain of going to the dentist. And what you're describing to me is exactly the opposite of that old fear.
Well, absolutely. And when I first meet patients, a good number of them are a little bit nervous, and I explain to them that if I hurt them, I'm really hurting me, and I don't want to hurt me, because I want them to walk out of here saying, "Well, that's a great dental office. Look what they did for me, and it didn't hurt me at all, and it was quick." And that's what we want to hear, and we make sure that we do that. And I tell all the patients, if we're having any difficulty at all, please raise your hand, let us know what's going on so we can make it comfortable for you.
Okay, so who should consider having an Invisalign procedure versus the more traditional braces?
Well, very good. And it's generally the general dentist, usually the general dentist, who makes that call. Anytime we do general dentistry, okay, run of the mill. However, we do a lot of specialty services, although we're general dentists. For example, we can remove infected or broken teeth. That's oral surgery, but we're not oral surgeons. We do some braces, orthodontics, but we're not orthodontists. We do some root canals, but we're not endodontists. We do some gum therapies, but we're not periodontic specialists. Okay, so what we do is we do run-of-the-mill, and if we see something which is out of the box, out of our comfort zone, I don't see this every day, that's when we need to go to a specialist.
Okay, okay. But I didn't hear a clear answer on who should consider this type of treatment, the Invisalign treatment. You said that it's the call of the general dentist, but why are they making that call, as the difference between braces and Invisalign?
Oh, well, there's different levels. There's different levels of malocclusion, and there are different problems, skeletal problems as well, how the bones of the skull are put together. Okay, we are not specialists in that area, or at least I'm not. Okay, and
Okay.
if I saw that, I would punt that ball over to the specialist, and I do that. I'm not embarrassed to tell you that.
Okay, yeah, that makes sense. So Invisalign is a type of treatment. It's not necessarily just to have invisible braces.
I'm sorry, could you say that again? I wasn't clear on that question. I'm sorry.
Okay, the Invisalign method of treatment is more of a type of treatment based on the condition of the patient versus a cosmetic desire to not to have invisible type braces.
Well, it is both, if I understand the question. I believe that it is both. It
Okay,
is a...
so let me rephrase it then. If I want, let's say I need braces, and I simply want to have invisible braces, is Invisalign a choice for me?
I think it is the choice for you.
Okay.
Now,
Gotcha.
is everyone a candidate? Is everyone a candidate for that? And I would say no, there are exceptions to the rule. But the vast majority, from my experience, of the cases that I see, our candidates do fall within the parameters that we're looking for.
Okay, that's fair. All right, this is the last question I have in this series. This is more along the lines of the types of things that people should be asking you, but they're really not.
Okay.
What should someone ask you during an orthodontic consultation?
Here's the question. What are my options? Now, even if they don't ask, we offer those options because we want to make sure what the chief complaint is. We have to be sure that we are going to provide an answer for their problem. Even if they are not able to articulate their concern, we want to elicit from them, what is your chief complaint? Now, let's find out how we can help you. And we can then write down option A, option B, and option C, if they exist. Sometimes it's only option A, or it's only option B as our solution to this problem. Okay, because I want to make sure that we have satisfied patients, that we've solved their complaint, their problem with their smile, even if it's just a perceived problem. So we want to make sure that we give them what they want.
Right. So sometimes it's not even a structural thing, it's a confidence thing that they want to have a better smile. Well, that doesn't really tell you exactly what the problem is, except that their end goal is they want to be more confident.
Correct. Absolutely. Absolutely. I want to look better. I want to have a nicer, prettier, hotter smile. I don't want to have to speak to people like this because I'm embarrassed about my teeth, and I see that every day. I see that every day. So I need to find out, is the problem with your smile the color? You've been smoking or drinking too much red wine or ketchup and mustard, that the color is dark and dingy. Is that the complaint? Or is it they're not shaped properly? Or they are chipped and broken? Or none of them match? A patient described just the other day for me that my teeth look like the Sherwin-Williams swatch fan, as they call it. You know, those color things which they show you all the colors of the paint, you know? And each tooth is a separate color. And so there are numerous cosmetic complaints. So I need to zero in and elicit from the patient, let me hear what the complaints are. And I should suggest to them, and I do, ask them, is it the color? Is it the shape? Is it the position? What is it exactly? Let's come to the conclusion, the correct conclusion of what is it about your smile that bothers you, so that we know how to best fix it.
That sounds awesome. And again, tell us about your free consultation.
You've said it. I love the idea. I love the idea of a free consultation. That if anybody is considering a procedure, if you're considering doing something to your home, how nice is it you can have a contractor come in and say, you know, I need more space in my kitchen. What can you suggest? Is it more cabinets, another closet? Do I have to bump out a wall? What are your ideas? And generally, contractors do that as a free consultation, and I think that's a wonderful way to do business. I really do. It's non-committal. No one is committing into a long-term marriage here, and I think that's a great way, great opportunity for people to come in and just sort of pick the brain a little bit from people that do this every day. This is what our experience is. The average homeowner doesn't necessarily have the access to other people's kitchens to see how to do it. Maybe yes, maybe no. So let me pick the brain of this contractor, see what he's got to say. I'll call another one in, and somebody's going to come up with something which fits my budget, my kitchen, my circumstance perfectly. And I think that's how it has to be with dentistry as well. So people just call up. It's a non-committal, free consultation. Come pick my brain. We'll give you half an hour, whatever it is. We'll talk it over.
Sounds good. All right, so Dr. Schuman, I appreciate your time, and unless you have anything else to add, I think we've covered this subject pretty well, and the common questions. So again, you're located in St. Louis, Missouri.
Yes.
It's the Schuman Center Dental Aesthetics.
Yes, that's correct.
Awesome. The phone number is right there for people to see, and until next time.
Thank you so much. Carrie, great talking with you again.
Thank you, Dr. Schuman.
My pleasure.